to The Way Home with Laura Smith, the show that brings you wonderful guests, helpful advice, and uplifting stories. The Way Home. Live inspired. Here's your host, Laura Smith.
One of my favorite all-time things to do, and the types of people that I love to interview. Some of them are musicians, and this week is such an incredible, exciting week for Elkhart, Indiana, being that our kind of world-famous jazz festival is getting ready to launch in about 4 days from now. I thought it only appropriate to bring in one of the big guns who's going to be playing on Friday night in Elkhart, and she is an absolute jazz virtuoso, Connie Hahn. And what it's said about her is that she is a boundary-breaking jazz pianist and composer who's redefining the sound of 21st century jazz. And she's also described as the jazz warrior goddess by Downbeat magazine. And she blends the fire of post-bop tradition with fierce modern edge, channeling the spirits of McCoy Tyner, Chick Corea, and Herbie Hancock, and a voice entirely her own. Connie, thank you so much for joining us. We are so excited to have you in Elkhart.
I'm so excited to be back. I had my debut there last year, and the band really connected with the audience, and we look forward to continuing that and sharing more of our original music and the musical journey.
Yes. The song we came in on, Prima Materia. Tell us about that. I love the names of your songs are actually exotic and unique. Where do they come from, and why did you choose them?
Well, it starts with the concept behind the album in which the tracks are on. And the original conception was inspired by the Sumerian myth of the goddess Inanna. And she, as well as Sumerian mythos in general, often references the primordial nature of the universe and where a lot of modern storytelling comes from. So prima materia in Latin, I believe, means the original material of the universe.
Uh-huh. I love that. You were known as a classical prodigy as a child when you started playing. How did you morph from classical to jazz? When did you find that was really the voice on your piano that you wanted to have? And how long have you been playing jazz?
That's a great question. I have been playing jazz since I was 14, and I had always been interested in other genres as well as composition and songwriting while I was studying classical music. And I think at the time my ear as a child wasn't mature enough to really appreciate classical music for what it is. So I had always had an inkling to rebel against my training and to pave my own path and create my own voice from a very early age. And jazz really fit that bill perfectly. And I'm really grateful for both backgrounds because present day me is very appreciative of music overall. So the tradition is the only pathway, I think, forward into really appreciating modern, innovative music and vice versa.
Mm-hmm. How old were you when you were playing classical as a child?
5 years old.
Wow. That's incredible to me. I can't even imagine. I can not even play chopsticks. So the thought of a 5-year-old learning classical music, for me, it takes a certain type of brain to be that advanced, and jazz, a whole other level entirely in its adaptation and in its presentation. Watching you in videos is really interesting. You have the same animation as you would expect a jazz player to have. And it's so fun to watch you. I know that sounds different because sometimes, jazz musicians can be quite serious, even though, their music is so unique and all over the place. But you have this energy when you play that is just, it's exciting just to watch you, let alone hear your music, which is so beautiful. So who are your favorite jazz musicians that you derive maybe the most inspiration from?
That is a very difficult question to answer because I think it's so important to not only check out one or two guys. I think in order to really make a statement, it's important to check out absolutely everything. But if I had to narrow it down, Freddie Hubbard, trumpet player, legendary. I think it's really important to absorb conception and vocabulary from musicians who don't play my instrument, the piano. So I actually was thinking this way yesterday when I was practicing, because that way you're able to get a really soulful sound, like the way that Dexter Gordon played, or even Coleman Hawkins, Charlie Parker, Joe Henderson. As far as pianists, I've been checking out Andrew Hill, Hank Jones, Bud Powell, and I also check out a lot of classical pianists as well for technique, because I think it's important to really formulate a philosophy out of everything one checks out musically, so that it doesn't become the trap of copying another musician, but rather taking what they did and really creating your own methodology out of it. So, yeah, I mean, I like to check out musicians who don't just play jazz. I mean, Martha Argerich, world-class concert pianist. And yeah, I'm always checking out different music because that's really important, because then otherwise jazz kind of stays within itself in its own sphere, which is fine. But I think that can be a little stifling and a little boring. So it's important to check out other musicians as well from other genres.
Well, I would say that never boring is it kind of says what you are. You're not boring at all. And you don't, to me, I'll hear remnants of some modern jazz that I've heard before, but I've really haven't heard anyone quite like you. So I think you've totally succeeded in creating your own language and your own sound out of maybe some influences by people that you truly love and admire. But I like that you also get inspiration from other types of musicians, not just pianists, to encourage your music as well. So that's very
because
unique.
There's sorry to interrupt you, but yeah, I mean, there's like a little bit of a stereotype surrounding piano players being very square, and for good reason. I mean, the nature of the instrument just isn't too. It can be sterile. So I think it's checking out tenor saxophone players, for example. I mean, the way, just the nature of how you approach that instrument, it forces you to be as musical and lyrical and as honest as possible at the instrument versus just throwing your hands in at the keyboard, which I see far too much. And soul has always been at the forefront of my thinking and my feeling whenever I play, because otherwise it just becomes a self-indulgent, like a showcase of technique versus it being about really connecting with the listener and yourself.
Yeah, I was with some jazz musicians once on a boat in New York, and a pianist by the name of Joey Calderazzo. We were neighbors, and
I know him.
Do you know him? Yeah, yes. He plays with Branford Marsalis, and
I just saw those two at Jacksonville Jazz Festival in Florida.
Oh, really? Okay. Mm-hmm. Yeah. We were 23 at this time, and we were talking a long time ago. But I remember I was playing some smooth jazz because I actually love smooth jazz. I grew up in Brazil during the bossa nova time, kind of, and that kind of led me to appreciating smooth jazz. And so I brought a cassette tape onto the boat and I started playing it. And he looked at his brother, who was a drummer. He is the pianist, and he's like, "Yeah, this doesn't say anything." I was like, "Well, I guess I won't bring the music to a musician's boat ride anytime soon." But I love smooth jazz. It was the first format that I ever disc jockeyed in radio 30 years ago when I started in Greenwich, Connecticut at a radio station, and I will forever love it. But the straight ahead jazz of of so many greats and, being around musicians, like him and stuff, and then hearing you, I can see where you might say, well, it doesn't quite say as much. But you're you sound almost like you're a fusion to me of so many different styles.
I would say so because I check out everything. I think the most important thing is having a really sophisticated and fluid sense of rhythm and harmony, which I take mainly influence from 20th century classical music, from Russian and French composers. And then when I have those those foundational techniques together, I definitely feel like super excited to explore and be adventurous musically with like all the genres I check out. Like I really like hip hop too. I like rock. I like alternative. And I also like the Great American Songbook. I mean, I consider myself kind of a futurist in this sense, because there are times when I think about all this stuff and I want to just, like you say, like continue to develop that language. And it's really exciting because music is one of truly the only avenues, I feel like, at least as far as I know, where you can truly exercise this. I mean, maybe some people in artificial intelligence can think that way, like create a new line of code, but nothing with the sort of emotional weight that music can provoke. So it's very humbling.
I bet it is. And I'm just thinking, I don't know why, but this strikes me like, what did your parents think when you veered away from classical? Since you started at such a young age, I'm sure they had a lot to say in your growth and your learning piano at the time. What do they think of the trajectory you've taken all these years later?
I think they are surprised and I think humbled because they, at the time when I started, they were very unhappy because they associated, I mean, for good reason, jazz musicians with a certain lifestyle and a certain, I don't think they really appreciated the music. So right now I kind of, when I talk to them about what I do musically, I think of myself as an ambassador because I do think it's important to help people understand why jazz or jazz is the, I mean, it's the only indigenous American art form. So, and it's highly intellectual. And I think people misunderstand that, especially like people in music who casually check out jazz. And that was kind of my parents. And I think now they really appreciate the fact that it has given me a fresh perspective and like an angle to approach the music they want me to play, which is they really wanted me and still want me to be like a classical concert pianist. And that's not something that's actually that's not like necessarily not possible, which is really interesting. And like the whole thing is, I mean, that's been historical throughout classical music too, just composers checking out like Art Tatum, for example. And I think as I communicate to them more about, my interest in this work, like they're like, wow, this is really, really fresh. And because one of the biggest criticisms is that classical music is really boring and can be, and it's important to bring that like perspective, like that rock star kind of perspective of like taking risks and improvising and doing it within reason, like doing it within like when you've practiced enough, you're able to break the rules. And I think my lifestyle and the way that I go about making music, I think now my parents understand that it's actually very important for life. Do you know what I mean? Like those skill sets you can apply to like being adventurous in life and not being afraid of doing certain things. And I think it's funny. I always tell people that this music keeps people young because it's so unpredictable. And part of why I rebelled against my classical training initially is that it's predictable. You're like learning other people's repertoire and playing it over and over again,
Hmm.
like on tour. And that can be very boring, you know? So the unpredictable nature of jazz, yeah, I mean, that's the way I like to explain it. Because when I see the way that jazz is portrayed in media and just like even in Hollywood, I'm a little bit indignant because it just barely scratches the surface of what jazz is. Because it's not just like dressing on a salad. It's not just like ornamental background music that,
Right.
I mean, it sometimes is. But if you really dig deep, it can be the source for everything. I know that a lot of composers and pianists and musicians, they think this way, but the world doesn't. And my parents are starting to understand that. So I think that's really cool.
I do too. For some reason, I just had a feeling I could imagine, this sort of, not horror, but like what happened. We had you on this trajectory, and now you're veering off. But then, in seeing your immense talent and really groundbreaking technique in the way you do it, because really the way you play isn't something I've heard before. I saw you last year, and so. I really,
Thank you.
I truly think that everything you said is about that with the unpredictability, but yet you've been explained as having explosive technique, and I think you do. It's obvious watching you play. So it's such a beautiful. It's exciting to me. I think jazz is true, and because it is our sole American, true American owned music, it just makes it all the more meaningful. I think. Jazz is here to stay, forever will be, but you're going to take it and push the boundaries of it so that we hear it in a different way than in the way I started hearing it as a young girl and, my parents and all throughout these years. And I think what you're doing is you're keeping it fresh and you're teaching us and you're pushing us into the boundaries with you. And so we're just so excited to have you back this week and to be able to see somebody of your caliber in our beautiful, hometown of Elkhart, Indiana is really an honor and a gift. And so we're so excited, Connie Hahn. I want to go out on another piece of your beautiful music. What would you like to pick for us this time?
Gilgamesh and the Celestial Bull from Secrets of Inanna.
Now that sounds amazing. Secrets of Inanna is the album. Thank you once again, Connie Hahn. You can find her at conniehahn.com and get her music wherever you get your music. Thank you so much. We'll see you this week at the Jazz Festival.
You're listening to The Way Home with Laura Smith. Once again, here's Laura.
Well, did you know that 1 in 110 babies born in the United States have congenital heart disease? That is just staggering. I had absolutely no idea. Thankfully, there are some wonderful advancements in the care for children and babies with congenital heart disease and amazing doctors like Dr. Matthew Elias, who is an attending pediatric cardiologist in the Cardiac Center at Children's Hospital in Philadelphia, very famous and known, called CHOP. So, doctor, thank you so much for joining us today. That is unbelievable to me. I had no idea it was so prevalent among children.
Well, thank you very much for having me. It's great to be here. And you're not alone. I feel that congenital heart disease occurs so much more often than many realize. As you mentioned, it occurs in 1 in every 110 babies in the United States. It's about 40,000 babies each year. And that makes congenital heart disease the most common birth defect in the United States. And to add to it, about 1 in 4 of these children born with heart disease have a critical form of congenital heart disease, which means that they generally need an intervention in the first year of life.
So how is it? Are there more babies being born with it now than ever before? Or is this kind of the way it's always been? And we're just hearing more about it and hearing about ways that it can be mitigated or improved upon. What's causing this?
I think there's so much more to learn about what is truly causing congenital heart disease, and there have been different studies looking at the incidence. I think we are picking up congenital heart disease more often now, but in a positive way, in that we're able to diagnose it earlier, even before birth. As far as the causes, though, our knowledge base is going to only continue to expand. We know that some forms of congenital heart disease are associated with genetic conditions, but many are sporadic and random, and there might not be an identifiable known risk factor in those children.
Okay. So when you do find this, you said sometimes even before they're born or after, is there anything that you can do while they're still in utero to help them?
Absolutely. So many forms of congenital heart disease are now diagnosed before birth, and that will often occur during the routine anatomy ultrasound that mothers have around 20 weeks during pregnancy. And if there's an abnormality there, often then referred to a specialist, such as our fetal heart program at my institution at Children's Hospital of Philadelphia. We can then perform fetal echocardiograms, really identify and make the diagnosis of that form of congenital heart disease. And once the diagnosis is made, in that case, before birth or after birth in different situations, it's so important to then have understanding of what that heart condition is for each individual patient before birth. There is an importance to make sure that the families are prepared for what that diagnosis means, what's the prognosis for their child, to make sure that they're being delivered at the right facility. For instance, at my hospital, we have the Garbos Family Special Delivery Unit, which is a dedicated facility in which mothers carrying babies with known birth defects, including congenital heart disease, can be born at our children's hospital. And that's important to figure out ahead of time, to figure out how do the children then at birth receive immediate care.
And then for the babies that are born that may end up having that, but it's something that no one knew going into it, do they express some type of symptom or some type of signs that they're having an issue with their heart?
Yes, and it definitely varies based on the type and severity of the specific form of congenital heart disease. So for all babies born in the United States, in every state, there should be, and there is right now, mandatory screening in which babies have a non-invasive, very quick oxygen level checking to make sure that's a normal level, which is so effective in catching critical congenital heart disease, which means that those babies are going to have an intervention the first year of life, typically, to catch that before they become problematic. But the newborn period, there could be signs that a primary care provider picks up, like an abnormal murmur or other signs on examination. And it's also important for families to be aware of potential symptoms that could occur over time, such as chest pain, especially with exertion, faster heart rates, fainting, especially suddenly without warning or with exertion. And while many of these different symptoms are quite common in children, don't always mean that there's going to be heart disease. They always require an evaluation by a primary care provider to help families determine if this is a concern.
Dr. Elias, what do you think in terms of the future of cardiac care for children? Is it just getting better every day? Are we learning more? And what are the interventions? What does that look like for the future?
Yeah. Yes and yes. We are learning so much every day. I always say pediatric cardiology is in its infancy. Only a few decades ago, there were conditions that sadly were universally fatal, and that is so different now. We now have treatment options for so many of these different conditions. The future is so bright. There are now minimally invasive procedures such as cardiac catheterizations that are becoming more common in certain heart defects, often replacing open heart surgery. There's advancements in fetal diagnosis before birth, even some interventions before birth, which I think would be incredible for the future with advancements in that aspect. There's also more sophisticated imaging techniques, including 3D models, so that we can really focus and improve our understanding of each child's individual heart condition. And when used appropriately with adequate research to make sure it's safe and effective, I think there's going to be a role for artificial intelligence in medicine and in different capacities. There already is, including pediatric cardiology. Overall, I'm very optimistic for the future as we continue to expand our our knowledge and understanding of our patients to improve their lives.
So take heart, in other words, no pun intended. That is super comforting to hear. I'm so grateful to know that all of this exists and that many children that maybe are born with congenital heart defects can go on to have healthy lives later on. Is that true?
Absolutely. Thanks to this different research, innovative treatments, surgical or otherwise, we'll tell our families that 97% of children born with congenital heart disease are expected to reach adulthood now. And we'll often say, and others will say, that there are now more adults with congenital heart disease, compared to children with congenital heart disease because they're living longer and reaching adulthood and doing well.
Oh, thank you so much. That's wonderful news. If there's someone who's listening and says, oh, I really need to know more about this, where would they go?
So listeners can always learn more at our website, which is quite large, lots of information, and they can always reach us too at chop.edu/heart. That's chop.edu/heart.
Dr. Matthew Elias, thank you so much, changing the lives. And this is something that I had no idea about, but my eyes are open, and I thank you so much. It's so good to know that you're all there. Thank you.
Well, thank you. It's been my pleasure.
Thank you for listening to this edition of The Way Home with Laura Smith. I want to wish all the great dads out there a very, very happy Father's Day. I want to wish it to my own dad, Tom Smith. He's watching from heaven and listening from there, too. I know it. He always encouraged me to follow and pursue my dreams. I couldn't have accomplished anything I have over the last several decades in radio without his love and encouragement. So, Dad, here's to you. And once again, to all of the wonderful fathers listening, God bless you. And thank you for listening to The Way Home. I'm Laura Smith.
Podcasts by Federated Media.